Welcome to Hacks in Austere Environments. Today we're talking about creatively using the equipment you have at hand in austere environments to save lives. What's unique about this presentation is the collaboration with our global emergency medicine colleagues. Let me introduce you. We have Yasein Omer, who is from Sudan, as well as Pascal Mugemangango from Rwanda, and Tumusiime from Uganda. So let's get started with the objectives.
So our objectives in this presentation is we would like to identify low cost and low fidelity materials that can be used in emergency situations in low and middle income countries, as well as in austere condition in different settings. We would also like to explain how utilization of low cost materials improves patient care. We would like to equip providers with skills to create emergency equipment from low cost, locally available materials. The importance of this presentation is, as you know, for example, shortage of oxygen in New York, Italy, and Sudan during the COVID pandemic. It was a serious challenge that forced even the countries with the strongest and the most resilient health systems to have to deal with limited supplies. In our setting, for example, most hospitals, even the ones with enough oxygen supply, face serious shortages with oxygen ports and flow meters due to the surge of patient numbers. So as a background, although increasing globalization and advancement in technology has improved patients' lives, some austere settings still do not have the supplies they need to save lives. When we say austere settings, we mean low and middle income class countries. We mean rural and mountainous areas in countries like the US, or areas served by the US military, areas where supply chains have been hit hard by the COVID pandemic, for example. In these austere environments, modern medical supplies equipments are either expensive or not enough to meet the demands of the population and communities served. As a result, medical workers in these areas are forced to improvise with the locally available materials in order to save lives. Most of these challenges have been properly highlighted in some journal articles that you'll find in the slide for references. In our presentations, we are going to be sharing some of our learned lessons and hacks we've developed over the years, practicing emergency medicine in these low resource settings. So today we're going to discuss how to convert a nasogastric tube into a nasopharyngeal airway. We're also going to discuss how to substitute cotton balls for EKG electrodes. We're going to show you how to use a nasogastric tube as a chest tube with an innovative chest drain. We're also going to show you how to split oxygen from one source to cater to more than one patient.
Let's take a look at how to create a chest tube with an NG tube.
Hello everyone, my name is Dr. Pascal from University of Rwanda. I'll be talking about how to make chest tube from NG tube. Normally we have a chest tube which is expensive and it looks like this or this. Usually out of this normal chest tube because of too many trauma patients. I'm going to show you how to make a simple chest tube from NG tube. Before we start, let us first identify materials to be used. So here we have a simple NG tube number 18, of course, which is big to use. We have scissor or surgical blade and other materials needed in chest tube placement, like gloves, suture, cleaning solution, anesthesia, and dressing kit. I will now show you how to make a chest tube from NG tube. Step 1, we take this, our NG tube, we remove it from the cover. Step 2, we see from the top, we have some holes which are few. So we need to add the more to make it HA tube. So from the top, we add the more holes using our scissor or surgical blade. So now our chest tube is ready to use. So we use it, we place it in other materials, then we start our procedure of chest tube placement. Thank you. So I hope you learned a lot about how to make this simple chest tube from MBchB. Next, we have Dr. Simon, who will be talking about the splitting of oxygen from one source. Thank you so much.
Hello everyone, my name is Dr. Simon Tumusiime from Uganda, and I'd like to take you through this part on how to split oxygen from a single source. But first, I wanted to share about my experience working with this particular hack and why it's important. I'm currently working in one of the busiest regional referral hospitals in the country, where we see numerous numbers of patients on a daily in our emergency department. This takes a toll on our resources, especially oxygen. For example, we have 5 oxygen sources, and using this hack enables us to split the oxygen among 10 people. So with knowledge of this hack, I was able to train a number of my colleagues, and were able to treat patients and save lives, especially to pediatrics and the elderly, who oftentimes come in very critical conditions and require immediate oxygen support. Also, another situation where this hack might be very useful is in the current COVID-19 pandemic, where we have supply chains being affected by high demand. There have also been several new articles that have been published to date that have emphasized the need for oxygen therapy in developing countries. An example is influenza preparedness in low-resource settings, a look at 12 African countries. An article published in the Journal of Infection in Developing Countries in 2010 by Janelle M. Bell et al. This article looks at the scarcity of oxygen delivery systems in low-resource settings, despite its importance in management of the pandemic and other diseases. Another article is Oxygen is an Essential Medicine, a call for international action. An article published in the International Journal of Tuberculosis and Lung Disease in 2010 by Duke and Graham et al. This article emphasizes the importance of reliable and low-cost oxygen sources to treat hypoxemia, a cause of high morbidity and mortality in developing countries. So with knowledge of all this, let's go ahead and talk about how do you split oxygen from a single source. So with me here, I have the equipment that you need to be able to perform this particular hack. I have a simple regular stethoscope, which looks like this. I have nasal prongs. I have a simple oxygen mask. You can choose to use 2 oxygen masks or 2 nasal prongs, whatever you want to use. So let's go ahead and perform the hack. So the first step is get your simple regular stethoscope, take out the chest piece, take out the 2 earpieces, connect the stethoscope to the oxygen source by the stem, turn on the oxygen source, connect the nasal prong separately to, and the oxygen mask separately to each ear tubing. And there you shared your oxygen. So thank you for watching this. I hope you liked our presentation. I hope you learned something. Please go ahead and share it with your colleagues. About the articles I've shared about, you can check them out in the reference section. Thank you so much.
Okay, so for our second hack, what we do is we use cotton balls to make EKG electrodes. And how we do that is we just get a simple cotton, cut it up into small pieces, dip it in water and almost daily, whatever you choose it to be. And once you have 3 of them ready, you will attach one of them into each one of the electrodes.
So once you've connected all three of them, you need to make sure that the content is actually coming out. So when you attach it to the patient, you attach it to the patient like so, and then you just use this fast link to stick it to our patient. And now you can just watch the ECG for a reading. So yeah, what we're going to do is we're going to insert it through that, and we're going to pierce it on both ends. And now that it is pierced, you just make sure that it stays in. And now you can insert it as a regular nasopharyngeal area, and the paper clip will make sure that it doesn't go beyond the patient's nostrils. Thanks.
And there you are. Those are your hacks in austere environments presented by our very own global emergency medicine physicians. Here are the references if you'd like to take a look at the articles later. Also, we'd like to thank GEMA, the Global Emergency Medicine Academy, for sponsoring us. Thanks again. Till next time.